So when the tug goes on, which I can hear, we all say a prayer for a safe journey. And babies are being born above me all day. And in fact, my children were born up there. So anyway, I've experimented a lot with pregnant moms and just different things that have come to me when I'm taking care of them. I've adjusted moms who are in labor. That is the best time to adjust them when they're in labor. It has helped women who are stalled in labor to move and to be able to successfully have the baby born without intervention. So that has happened a couple of times and has been amazing. But what I started to do was I clear out the mom and then I check on the baby. So the same way that we have talked about remote adjusting, it's kind of the same thing where I just shift my focus on the baby and ask, is there any, may I adjust you? May I check you? And I always get a yes. And then I proceed. So that's what I was going to do with Anna today, is that I'll check her and then I'll check on the baby. And the moms, of course, love it because they only want to do the best thing that they can for their babies, and adjusting is the best thing. Do you want me to talk out loud? Or?
Yeah. Oh, yeah.
Okay, so I start out always with saying, you keep your energy, I keep mine, because I had issues with taking on too much of other people's energy. So that's what I do. Again, this is very fluid. Everyone needs to do what works for them. So you keep your energy, and I'll keep mine. But I love you. And I'm here to serve the highest. So is there a priority? Yes. Above the waist? Yes. Cranials, sphenoids on the right anterior. So my access point is kind of my way in. Could you back up just a little bit? Is this sphenoid? Priority above the waist, cranials, sphenoids on the left anterior posterior. Doesn't that mean something?
I think we get that from you,
Doesn't that mean something when there's double posterior sphenoids? Mentors? No?
It means it's a double posterior sphenoid.
Okay.
Yeah, it's unusual.
Yeah.
Maybe it's a pregnancy.
So stress patterns. Which is typical for moms, for pregnant moms. Where is she? Right here. So I usually ask, where, if it's a cesarean scar, then I ask.
Just a point of reference, I had a daughter 3.5 years ago, and at 40 weeks she went breech. She flipped. And this is pre-KST, and I truly believe, I had major hip issues. I fallen on the stairs. I was always in pain. I was like Ted, just always in pain, more pain than my patients. And when I was diversified adjusting, 8 months pregnant, as big as a house, and adjusting a ton of patients, and threw myself out so bad I could not walk. Maternity leave started the next day, and it got to the point where I was basically screaming because it hurt so bad. And so I took 5 months off, and KST saved my life.
Wow, I didn't know that.
Is there a priority? No. Is she processing? Yes. Can we speed it up? No. Take a deep breath in. Is there a priority? No. Are you sure? Yes. Okay. So now I say I'm going to check on the baby, and may I adjust you? May I check you? Yes. Is there a priority? Yes. Above the waist? No. Below the waist? Yes. Lumbars? Yes. On the right? On the left? On the right? With a disc? No. Okay. L1? On the right? Going inferior? So, I just find that fascinating. So, she has no lumbar stuff, but the baby has lumbar stuff. And the way I take it is that it's not the baby having lumbar stuff, it's that this is going to help the baby be more comfortable, maybe, inside, or help them get more nutrients or whatever it is that this baby needs to grow the best that he or she can. Okay, is there a priority for the baby? Yes, above the waist, below the waist, anterior stress pattern. Yeah. And then I always just send a little sign, a little love in whenever there's a panic pattern for the baby that it's okay, you're good, your mommy's good. Your priority? No. Are you processing? Yes. Can I speed it up? Yes. So take a breath. I do find also with newborns that they need a little more time in between adjustments. They'll shut down and they need, and I just kind of hold my hands and wait, for 30 seconds, a minute, and then I check them again. But they seem to need that more than adults do in my office. Is there a priority for the baby? Yes. Above the waist, below the waist, anterior, posterior extremities, subbeds, scars, endocrine dehydration, valves, ileocecal, clockwise, counterclockwise. That I find is a big one too for babies and mommies, little digestion and stuff.
And valves are usually a little tender. FYI.
Yeah. Is there a priority? No. Baby's processing? Yes. Can we speed it up? No. Anything else stopping this person from healing? No. Anything else stopping the baby from healing? No. So, there you go. I only charge for one adjustment, though.
Thank you.